Hello, hello, hello. Facebook, Instagram, YouTube. It's been a while since I came on and talked about surgery. Hey, Missy. Gonna give everybody a minute to jump on. For the people on Facebook, if you could share the video, that would be wonderful. I'm going to share the video to my other pages. Tamara, it's been a long time since I've been on too for this. I haven't come on at night in a while. Okay, I'm sharing my video. Hi, Kelly. Hi, Laura. Hi, Angela. Hi, Carla. Hey, Instagram. Hey, Missy. Hi, Mila. Nice name, boo. Hi, Moni. Hi, Verdon. Hey. Carla. Welcome. Okay, I got to share it to one more place and I'll get started. Trying to share it to my personal page, but I can't. Okay. So tonight we're going to talk about tummy tucks. There are multiple different types of tummy tucks and multiple different techniques. What did I do with my pen? I'm pretty sure I'll draw. I grabbed my notebook and pen before I came over here, and I can't find a pen. So maybe I won't be drawing. Oh, I really want the pen. I know I need to draw. It's lost. Sorry, y'all. Hi, Christina. I'm so glad. So, hi, Frere Kinsley Petit. Frere Kinsley Petit. That's French. Hello. So, I guess I won't be able to draw because I can't find my pen. I literally looked for a pen before I came. Oh, I have a purse on my bed, so maybe there's a pen in that. There's Lip Plumper by Pretty RX in there. But I haven't come across a pen yet. My pen is broken. Okay, this looks promising. All right, we have a pen. Okay. So, my video keeps repeating everything I say. That's not good. Is it still doing that? Is it still repeating everything I say? Somebody, if it's repeating, if there's an echo, press ones. If the sound sounds clear to you, press twos. Because if I have to if I have to disconnect and reconnect, I will. Instagram is good. Okay, maybe it's just one person that's got that. Okay, maybe it's just one person. Okay. All right, so let's get started. So there's different types of tummy tuck. First, I'm going to go over who, in my opinion, my experience has been the best candidates for tummy tucks. So sometimes people will come into my office and say they want liposuction and they really need a tummy tuck, and vice versa. And I know people see my before and after pictures, and there's a lot of people that I do lipo on that other surgeons would do a tummy tuck on, and they get a pretty nice result just from the liposuction alone. So, thanks, Nikki. So my decision-making process for whether a person gets liposuction or a tummy tuck is pretty simple. If a lot of women, I would say probably 75 to 80% of the patients that I see need both liposuction and a tummy tuck. They usually need both in the front. Well, no, wait a minute. No. I didn't say that correctly. 75 to 80% of the women I see that need a tummy tuck need both. I see a lot of people who I feel like all they need is lipo. But of the people who need a tummy tuck, I would say 75 to 80% of the ones that I see that need a tummy tuck need both liposuction and a tummy tuck. So the way I think about it for most is I like to do all the liposuction first because I don't like to combine the two procedures at the same time. If a person needs liposuction in the front and a tummy tuck at the same time, then I stage it, meaning I do it in 2 operations. If they need liposuction on the sides or their back or somewhere else, I'll do that at the same time as the tummy tuck. But I won't do the tummy tuck and liposuction in the front at the same time. And the reason why that is because each procedure will compromise some of the blood supply to that overlying skin and fat. And when you combine them together, it increases the person's risk for developing necrosis. And for those of you who don't know what necrosis is death of the tissues in that area. With me, in my practice, with me staging the procedures, I have had 0 instances of necrosis, and I want it to stay that way. So I'm not really willing to take that risk, even though it's not like half or anything. It's like, below 10%, but for the people that happens to, it's kind of a devastating. It's kind of a devastating complication. So I won't combine the 2 procedures for that reason. So I make them get them broken up. So for most people, I will do the liposuction first. So some of the people that I have posted who had before pictures where you're like, they totally need a tummy tuck. I was aware that they likely needed a tummy tuck, but I did their liposuction first. And a nice chunk of those women will go on to say, no, thank you on the tummy tuck. Or even though they may still get it, they still have a pretty nice result just from the liposuction alone. Liposuction is a lot more powerful than people realize at improving the appearance of a woman's abdomen. Now, in the case of people who have really, really bad skin, so like it's been damaged and stretched out beyond repair, like the skin can't go back to how it used to be. Usually the signs of that is stretch marks or crepiness of the skin, and then the skin is hanging a lot. If it's just a little bit of hang and it's like superficial stretch marks, a lot of times that'll retract back just with liposuction. So if the woman isn't really concerned about the stretch marks, then I will offer them liposuction, and especially do it first because maybe they'll be fine with the outcome, and then they can avoid having that long incision, having that long recovery, because the recovery for liposuction and tummy tuck are not the same. Like lipo is a couple days, tummy tuck is a solid couple of weeks off of work. So liposuction, you just need a couple days. So in the setting where I do the liposuction first, then we'll come back 3 months later and do the tummy tuck. And for some, like I said, they'll decide they don't even want the tummy tuck. Then there are some people that they're like, I really just want one surgery. And depending on how thick the front of their abdomen is, like how much fat they have on top of the muscle, I may say, let's do your tummy tuck first and we'll liposuction your sides and your back or whatever at the same time, because I'm okay with doing all that at the same time, because that operation, even though we can make it even better, we can make it even better if we come back and liposuction the front. They still look pretty good when they get those sides taken care of, get the back taken care of, and get the front tucked. They still look pretty good. And so some women are like, this is enough. I don't want another surgery. And then for the ones who decide they want to come back and get the liposuction still, I can do that awake without them even being put to sleep. Is liposuction like you're poking around and going by feel? Sort of. You're going by feel and knowledge of the anatomy. Yeah, it's more than just poking around. Like it's calculated. If the person knows what they're doing, it's definitely calculated. But you are essentially operating blindly because the skin is covering your field. Um, Thank you. So there's different types of tummy tuck. So the mini tummy tuck, we'll start from least to greatest. So there's a mini tummy tuck, which do a little. Oh, okay. I'm like, dang, this pen is not working. Okay. So a mini tummy tuck is going to have a small incision down low. And that's it. So the incision is kind of small. It's small. And really that is for the person who doesn't really have excess fat. They'll usually the people who are good candidates for a mini are thin and they just have damaged skin below their umbilicus or belly button. And everything else is kind of good and their muscles are pretty decent, in pretty decent shape. They don't have a big diastasis if they have one. And they just have a little bit of extra skin at the bottom and we just want to cut that away. They have this little baby incision, right? Nothing is done to the belly button. They keep their original belly button. They just have this little incision at the bottom. A lot of women come in asking for a mini because they're just thinking, I just want a little something to make it better. But very few people are actually, at least the ones who come into my practice, are actually good candidates for a mini. I rarely do those, like super rarely do mini tummy tucks. Most people, a lot of people, when you take that little skin away, it'll make a pull on the belly button, and so the belly button doesn't sit there that night. When you go and cut a chunk of skin out and then pull this down, it's gonna make a pull on the belly button, and then your belly button sort of starts looking like a little. When it pulls it down, it'll start looking like a little sad face. Like the belly button starts looking all sad when you just go and just pull without doing anything to like address the skin that's around the belly button. That skin around the belly button just pulls it down. It looks strange to me. So, it's a rare occasion for me to offer that to somebody as an option. Then the second time is the regular tummy tuck. The second kind is just your standard abdominoplasty. And with that one, you have your incision from hip to hip. Down low. You have an incision from hip to hip. And you have an incision around the belly button. And that's the standard abdominoplasty. During that procedure, your muscles are repaired. So in the mini, your muscles usually aren't repaired because we don't even go up that high to get to the full length of the muscle. In this one, your muscles, the space that may form between your muscles is repaired with, for me, I use 2 layers of suture to repair it. And then after that, the excess skin is pulled and cut away, and then things are closed, and a new belly button, a new opening for the belly button is created. Then there is what you call an extended tummy tuck, which with the extended tummy tucks, the incision kind of goes sort of toward the back, but not completely around. And that usually the person who needs that is someone who's lost a lot of weight, and in order to keep you from having those dog ears, you have to like extend the incision back until things kind of flatten. So that's usually for people who are a little bigger or have lost a lot of weight. And then you have what's called the fleur-de-lis abdominoplasty. And with that one, you have an incision up and down also. Now, the reason for having this incision, that is usually also in people who have lost a lot of weight. Actually, that's always in people who have lost a lot of weight. So a normal sized person who just has excess skin like of their abdomen and the rest of their body's been normal size like pretty much their whole life, they're not going to need that's called a fleur-de-lis abdominoplasty. They're not going to need that. That is for people who've lost a lot of weight. So they have excess skin in this dimension and in this dimension. And if you just only take it out in this dimension and this dimension is left with excess, it'll make the patient's shape more boxy, which isn't bad. Like some people some people are more curvy than others, and that's okay. But if you want to be able to get the waist in a little bit more in a person who's lost a lot of weight, then you need to pull in this direction as well, to pull the extra skin in this direction. And so that's when you have this up and down incision and the side to side incision. That's called a fleur-de-lis abdominoplasty. The point of the muscle repair, somebody just asked what's the point of the muscle repair. So let me draw another picture. When the muscles are damaged, it makes the belly project out even more than it normally would. The muscles are like a dam for your organs, right? And so if the dam is violated, then the things can push through. And so the muscle repair kind of like repairs the dam. So this is as if, wait a minute. Okay. This is as if the person's laying down on their back. Like this is back. This is the front of the belly. This is the muscle layer. This area here will be the fat layer inside. Those circles inside are organs, okay? Now, muscle damage, these are the rectus muscles that make up your six pack. These should be kissing. The ends of these muscles should be touching. When they're not touching, there's this space between it. That's called a diastasis recti. And you see the organs inside are kind of pushing on that, and it makes your belly bulge out. When those muscles are repaired, it's nice and flat. See how that one kind of peaks? It's because of this. It kind of bellows out. When you close that space, the muscles are reoriented flat. So it makes your belly flatter. So that's why you'll see people before the tummy tuck and they're like this, and after the tummy tuck they're like that. Because those muscles are no longer they bellow out when they're not attached. And when you go and take the sutures and bring them back together, it makes them flatten and keep everything back, and it'll be flat. When they're not together, they bellow. Like this tissue that's between the muscles is not strong and tense. So it just like gives when the organs behind it try to push out on it. So that's the reason for the muscle repair. When you see people saying, oh, I had a tummy tuck with muscle repair, tummy tuck without muscle repair, my tummy tuck always has a muscle repair. If I say tummy tuck, the muscle repair is implied. The only time that I did like a tummy tuck type operation with no muscle repair was when I used to do breast reconstruction, and we would take the muscle from the abdomen with the skin overlying it and take it up to the breast to make a new breast. And in that operation, you don't go and try to sew muscles together. One, you've taken the muscle out, but two, you just don't do that part of the operation at that time with the tummy tuck because it's too much morbidity associated with that. But in the regular cosmetic tummy tuck, the muscles are always repaired when I do it. Somebody said, oh, how I wish my muscles would kiss again. How can a person tell if the MR has failed? You would need to be examined by someone to figure that out. Oh, okay. So someone said I had a tummy tuck and experienced blood clots. Now I'm scared of the lipo, which was supposed to get done next. That is appropriate to be scared. That's like normal. What I will say is the few times that I've had patients get blood clots, it was with tummy tucks. Tummy tucks has the highest rate of blood clot formation of like really any of the cosmetic plastic surgery procedures. The reason being is when these muscles get repaired, so there's a big vein that travels in here that comes from your legs and goes up to your heart. And this belly has more space in it for the contents. Once this thing is closed up and stuff is tightened up, is less space for the contents of your abdomen to live. So basically, what ends up happening is that big vein that's going up to your heart, returning blood from your lower extremities up to your heart, it gets compressed. Now, surgery alone increases your risk for blood clot formation. Anesthesia increases your risk for blood clot formation. Not being as mobile as you normally would be increases your risk for blood clot formation. And then when you squeeze down the compartment that the organs live in, and so the vein gets smashed, it makes it harder for blood to return, and blood kind of sits and pools in your legs, and then you're like even more susceptible to blood clot formation. For that reason, all of my tummy tuck patients are on blood thinners for like the first 2 weeks. And if they're traveling from out of town, they'll be on blood thinners for 2 to 4 weeks. So, I've never had a liposuction patient, a person who got liposuction alone, have a blood clot. I've never had that. Not saying you can't. It's just that's not usually the setting where people get blood clots. How can a person tell? Yeah, if a person can tell if an MR has failed, if they get examined by a plastic surgeon, they can help you figure that out. Okay, and then the last type of tummy tuck is really what's called a circumferential body lift, and that's when the incision is carried 360 degrees around your trunk, so your belly is being lifted, and your butt is being lifted. And that's for people who have lost a massive amount of weight. That's for people who have lost a lot of weight. Average people who are, pretty much normal size and their skin is in good condition, they don't need that. That's almost always people who have lost a massive amount of weight. Jaquay Jones, go ahead and watch my replay because I went over many tummy tucks at the beginning. Can you explain how lipo can sometimes help with filling the gap on some occasion? I'm hoping that's my case. Filling what gap? I don't understand the question. Can you rephrase the question because I'm not sure what gap you're talking about? Will the fat go to a different part of the body? Good question. So when people get liposuction, when people are born, they're born with a finite amount of fat cells. So when you gain and lose weight, it's not that you have more or less fat cells. It's that the fat cells that you have get bigger or smaller. So like if you gain weight, the fat cells that you have get bigger. If you lose weight, the fat cells that you have get smaller. So when you have liposuction, you actually get rid of some of the fat cells that you have. So let's say your abdomen has 1,000 fat cells. And you get liposuction and now your abdomen has 500 fat cells. If you gain weight now in your abdomen, instead of having 1,000 fat cells get bigger, you're only going to have 500 fat cells get bigger. So your abdomen is going to seem relatively smaller than the other areas that still have all the fat cells they used to have to get bigger. So sometimes people are like, oh, the fat will go somewhere else. The fat goes everywhere when you gain weight. But all the other areas have all the fat cells that they used to have. And the area where you got liposuction has less than that. How would you know if you need muscle repair? Your doctor, your plastic surgeon will tell you if you need a muscle repair. If you need a tummy tuck, you need a muscle repair most likely. Stacey Russell says she had cancer before, and could she get a tummy tuck? You need to discuss that. Like, having cancer in the past is not an absolute contraindication for surgery. No, but you definitely would need to discuss that with your oncologist and your plastic surgeon to decide if it's a safe option for you. Radon says, how can we tell if our skin is good and possible to retract back in place from lipo? Your plastic surgeon will help you figure that out. So you're not supposed to figure that out. That's not for you to figure out. Are there different types of lipo? Yes, there are. I do traditional liposuction, tumescent. So when people say, is it tumescent lipo? All liposuction is tumescent lipo. So no one does liposuction without using tumescent solution first. You'll lose way too much blood. It's just no good. So it's standard of care to use tumescent solution with all types of real liposuction. Then there's standard liposuction. There's a variant of standard, which there's power assisted with it. So then there's laser types of liposuction, ultrasound liposuction, that's Vaser. So these other ones like laser and Vaser, they heat and melt the fat and also cause some skin retraction. Some say it helps with bruising and stuff like that. What I have found is those forms of liposuction that creates heat energy tend to leave more scar behind. So the amount of skin contraction you get with it, if a person truly needs help with skin contraction, is not enough to me to warrant all the scar that it forms. I used to do laser liposuction. I don't anymore. So, right, it's a wait and see if your skin retracts. What is a safe gap for tummy tuck after lipo 360 BBL? In my hands, about 3 months now. I don't do. There's some. If a person's really, really aggressive, it may be more than that. That depends on how you heal. It depends on the amount of aggression that's used and scar tissue that's formed. And you don't want to do the tummy tuck until things have gotten soft again. You see Instagram's questions. Thank you, Ambitious. Shay88. What do I consider a massive amount of weight? 100 pounds, 80, 100 pounds. What does aggressive mean in surgery terms? Aggressive means too much. That's what that means. A lot of times when people are trying to get aggressive lipo, it's a person who probably needs to be losing weight first, or a person who probably needs more than one round. A person that probably needs more than one round. And then doctors will say, oh, I'll do aggressive lipo, or the patient will ask for aggressive lipo because they're trying to get it done in one surgery. Aggressive lipo causes necrosis. Aggressive lipo causes fibrosis. It's just asking for trouble, and I don't do it. Are there risks from having lipo? Absolutely. Lipo can kill you if in the wrong hands. You can lose too much blood if the person doesn't stop when they need to stop. Contour irregularities, damage to organs if the person doesn't know what they're doing. It's a blind operation, so you need the person to really truly be an expert in anatomy and respect the physiology of the body so that you don't end up with a bunch of drama. Lipo and tummy tuck on a 65-year-old, will you do it or not? If they're in good health, I would. I don't have an age cutoff necessarily now. I mean, I'm probably not going to do a tummy tuck on a 90-year-old, but, if you're healthy, 65 is not too old. What areas are targeted during Lipo 360? Your abdomen, flanks, and back are targeted. Someone said aggressive is when the surgeon is rough-handed with the lipo. Now, it's more of a matter of the amount that's taken out that makes it aggressive or not. Because lipo is a physically taxing procedure, so that's normal. But it's really how much lipo is taken out. I mean, how much fat is taken out. Can I have liposuction if I have high blood pressure. Yes, as long as your blood pressure is under good control. Can CBD tea help with losing a fibroid? I'm not sure about that. What caused Kanye West's mother to die after surgery? I wasn't there, so I can't really speak on that. Are you opposed to a person having a second liposuction procedure on a tummy if they've had it a few years ago and have regained weight in that area? Is there a higher risk? No, I'm not opposed to that. That's okay. How should a breast reduction, lipo, and tummy tuck be staged? That depends. It depends on. Sometimes I stage that. Sometimes I don't. It depends on the size of the patient and how long I think it's going to take me. Some surgeons have people helping them with sewing and stuff so they can get more surgery done in a good time frame. So that answer is not the same for everybody or for every surgeon. Hey, Dr. Miles, is there anything anyone can do to prevent so much blood loss during lipo to ensure there is more fat that is removed during the procedure? Not really. Well, you can refrain from things that thin your blood, like alcohol, aspirin, non-steroidal anti-inflammatory drugs like Motrin, Aleve, ibuprofen, vitamins, and a lot of different supplements will thin your blood. So that's why a lot of those things are stopped like 7 days before surgery. But some people are just bleeders, and we actually don't know that you're one of those people until the surgery starts. So have I ever operated on someone with a kidney transplant? Yes, but usually it wasn't for cosmetic surgery. But it's not a I'm not necessarily opposed to it, but it would definitely be conversations between me and your transplant surgeon. The extra wing that hangs out above the bra, is that covered in Lipo 360? No, that is an extra area. I'm considering 360-degree lipo. I may need to lose weight first. Not sure if I'm a good candidate. Yeah, that type of thing is discussed in your consultation. What, like those things for individuals. Do you perform a tummy tuck without muscle tightening? No. I think tummy tucks without muscle repairs are stupid. That's just my personal opinion. I think it's dumb. Fix the muscles. Can blood clots be prevented after tummy tuck? If I had one patient, one of the people that I've had get a blood clot was actually on heparin. So while there are things you can do to reduce the risk, if it's in the stars for you to get a blood clot, there's not much that I can do to stop that. And that's why your medical history is taken so seriously. You need to be honest about things going on in your medical history, and make sure you're compliant with the instructions that the doctor gives you. Make sure you're getting up and moving around after surgery. You know, a lot of times people will get tummy tucks and think they're supposed to be in the bed like they're sick. I make my patients get up and come to my office and see me the day after surgery. Like, I know you have to get up, walk to the car, get in the car, walk in my office, walk down the hallway, sit in the chair, stand up when I'm changing stuff around, walk back to the car. Like, you need to move. So there are definitely things you can do to reduce the likelihood of it, but doctors are not God. So sometimes things still just happen. The areas that are lipo with Lipo 360 is your abdomen, flanks, and back. And for me, back is bra strap down. If you want to book, Kanisha, if you want to book a Lipo 360 with me in January, you're already too late. I only have a couple. January's done. December's done. I have a few dates left in February. I'm literally booking into March. So if you want, like, January is out. If you want surgery with me before the spring, you better hit the website up tonight so somebody calls you tomorrow and gets you on the schedule. Can fat embolism be prevented, or is it just rare by chance? Yes, fat embolisms can be prevented. the doctor needs to not inject fat into the muscle. Gotcha. If you want it done in March, then you don't want to wait till January because March will be booked up. Because we're booking in March already and February is practically gone. So if you wait 2 more months, then March will be gone. So if you want a March surgery date, you need to get a consult right now, because there will be no March surgery dates in January because we're already using up March surgery dates right now. If you already had your consult, call and get your date, because you won't have a March surgery date if you wait till January. The only thing I could probably do in January is awake liposuction. There's no more OR slots. Awake liposuction, I can, possibly finagle. Yeah, if you had your consult and need to book, you need to call and book, or you still won't be in March. What is required to pre-book? What do you mean pre-book? Like, book a surgery date without having a consult? You can't. You can't. But once you have your consult, you just have to put down a deposit, which is 10% or $600, whichever is greater, to hold a spot. When are you coming out with a microneedling device? That is a wonderful question. You mean the microneedling device for Pre-RX, like that you use at home? Or like a microneedling device that's, professional grade for the office, like a microneedling pen? Which one do you mean? My preferred BMI for liposuction is 33 or less, and for tummy tuck is 35 or less. I don't see many underarm fat removal. Is there a proper name for that surgery? Underarm fat removal. How long do you have to wear those socks? Probably while you're not as mobile. Once you start moving around like normal, you can take them off. How is CBDT working out? Pretty good. I like it a lot. It keeps me calm. I sleep better. I was losing weight at first, but some days I don't take it. You're really supposed to take it twice a day to lose weight. So I haven't weighed myself in a couple weeks. So I can't say that I haven't lost more weight, but I feel like I'm about the same because I don't take it twice a day. But I do feel a lot better. I haven't had a headache in a long time. It just makes you feel better. Once you's at home, that'll probably be in January. It'll probably be in January. The reason being is because I'm trying to pair that with a mask, and the mask is still under construction. So I'm going to bring that out with at-home mask, like sheet mask. How do you calculate your BMI? Go to Google and type in BMI calculator, and free websites come up, and all you got to do is punch in your height and your weight, and it'll spit out your BMI. Demisha, go back to the beginning of this video, watch the replay, and I talk about trying to combine the two procedures. Yes, so somebody said, have any of your patients ever told you they get full faster after tummy tuck with muscle repair? If so, why is that? Yes, that's normal. Because it's like, how do you feel when you have on a waist trainer? Don't you get full faster? The container that your organs are living in is smaller, so everything is smashed. So like when you go and eat, your stomach can't just expand the way it would if the container was still big. So you get full much faster. Do all surgeons believe in BMI because it's written in a book? Because I don't think it applies to certain people. The ones who know what they're doing believe in it. So the people who call themselves cosmetic surgeons who don't know anything about plastic surgery principles and safe plastic surgery, they probably don't know that they should be paying attention to people's BMIs. The reason why the BMI is important is not different for different people. Like for the most part, if you are really, really overweight, your risks with surgeries in general, not just cosmetic surgeries, for complications and risk for the bad complications are higher. And so also satisfaction is much lower in the outcome as far as the patient goes when your BMI is higher. So from a safety standpoint, you're at risk for higher risk for necrosis, for infection, for blood clots, everything, the higher your BMI is. So doing cosmetic procedures on somebody with a BMI of 40 is literally asking for a complication. You're almost guaranteed to have one. For a surgery that you don't need, you just want, it's just not a good idea. It's better to get down to a safe weight, get down to a weight where the complication profile is dramatically reduced than to just try to force it at a heavier weight. Because at the end of the day, if you look good but you're not in the best health, that's not good. Like being overweight, like really overweight, is not good for you. It's not good for your heart. That's why you don't see fat 95-year-olds. In general, there's always exceptions to the rule, but in general, it's a rare thing to see somebody that is a BMI of 40 and 95. So no matter how much people try to rationalize and say, I'm healthy, it's just not good. So you need to be in a place where your complications are normalized and stuff like that. I don't like complications. Do you require a hemoglobin number for surgery? Abso-freaking-lutely. Yes, I will eventually come out with a red light therapy for home. What lipo can be done while awake? What areas? All areas can be done while awake. I've done all areas awake. Awake lipo is whether or not I allow somebody to get awake lipo really depends on their BMI. So while my liposuction BMI is 33, in order to get lipo awake, you have to be under 30. No, I don't specialize in lipo and tummy tucks only. I do a lot of liposuction and tummy tucks, but I do plastic surgery all over the body, and I really love face. I do a lot of non-surgical face. I do some surgical face, but I'm not like, oh, I just do lipo. Absolutely not. I do breasts, I do thighs, I do arms, face, as I said. I had 4 C-sections. Would I be a high risk for liposuction? No, not necessarily. All right, let me see what yes, massages are necessary after lipo. Right, lipo is not for weight loss. Exactly. All right, y'all. I guess I'm going to go ahead and sign off. Why are massages necessary? Because they help they help keep the tissue soft. So when hard areas try to form, it softens those up and smooths that out. It helps get the swelling out faster. It helps make the contours more smooth. It helps the skin shrink better because the skin isn't staying stretched out from the swelling. I mean, it is just, if you're not going to follow the recommended post-op procedure, don't get the liposuction. You're just wasting your own money, putting yourself at risk for nothing. A plus size tummy tuck to me is over BMI over 35. Yep, I do scar treatments. I'm a plastic surgeon, honey. I do all that plastic surgery stuff. Yep, I do that. Yeah, that's not likely for me to be on a show with Dr. Terry Dubrow and Paul Nassif. Yes. I live in Atlanta, and that show was filmed in LA, so that's not likely. But I got some stuff cooking. Can you do fat transfer into calf muscle? Yes. Technically, yes. What's good for cellulite? There's a few things out there for cellulite. One of the things, depending on how bad it is, you can do Sculptra in the dents. There's some machines. I have one that helps with cellulite, but you have to just keep getting it. So it's really, I'm like, I don't really suggest it very often because I don't think it's really practical to think somebody's going to be coming in for the rest of their life every month for cellulite treatments, but maybe they will. And if you want to do that, then I definitely have a machine that can help with that. There's also a modality called Selfina, which I don't have, that helps break up the, it's an in-office procedure, helps break up the attachments to the skin that causes the dimpling. I didn't like the price point of I didn't like the cost to me, and therefore I felt like it would have made it a cost to you that wasn't really good, so I didn't get that. Is there swelling 4 months post-op tummy tuck? Absolutely. You swell for about a year or so after a tummy tuck. I don't really do nose jobs. Like, I'll do a simple one, but I don't do like complex one. If someone comes into me for a rhinoplasty consult and it's complicated, I will refer them to someone else. I will have to see the mark for Dawn. She said, is there a procedure to remove marks on the body besides bleaching? I gotta see it. All right, so I'm gonna go ahead on and sign off. You're welcome, Shalita. For those of you who are interested in my CBD detox tea, that's what I was just swirling on. If you're on Instagram, you can just click the link in my bio and it says CBD tea. You can get it that way. For any of you on this video, you can DM me and I'll send you the link, or I'll put the link in the comments. If anybody's interested in a consultation, if you want surgery before summer, and be out of your garment and stuff before summer, you probably want to call now. Because like I said, February is almost gone, and we're already booking March and April. January's gone, December's gone. The only thing I may be able to squeeze in before in December or probably not December, is maybe January, is awake liposuction. But anything else, like where we need to go to the OR, is booked up into February, and so you better call soon. Yep, T also gets belly smaller. Okay, I'll put the link to the tea in the comments. If you want to lose weight, take it twice a day. If you want to just detox and be cleaned out and rest and all of that kind of good stuff, once a day. I take it at night because it makes me sleepy. All right, everybody. I'm Dr. Myla Bennett of Adarabella Plastic Surgery and Medical Spa. Also, Dr. Myla Bennett of Pretty RX by Dr. Myla, the most fabulous medical grade skincare line on the market. You can reach me on my website, www.ederabella.com, or you can call my office at 678-325-0006. If you would like skincare, go to www.myprettyrx.com. All right, bye.